that is for health systems to assess their vulnerabilities to climate change, the risks that they're facing to climate change, and as a result, to develop the national adaptation plans to plan how they're going to protect local populations from heat exposure. And as you can see there on screen, we're still seeing very few countries that have undertaking the vulnerability and adaptation assessments and that have developed their adaptation plans globally. In 2023, only 50 countries had done the vulnerability and adaptation assessments, and only 43 the national adaptation plans, although driven by the WHO's ATTACH, there's the Alliance of Transformative Action on Climate and Health, that has brought together countries to come to COP, that has brought together countries to address climate change. We've seen a very big increase since 2022. So there's positive trends here. We're seeing more and more healthcare workers that are engaging. We're seeing more health systems that are preparing to cope with climate change, but still we're nowhere near the level of adaptation that we need to be able to avoid the worst impacts of climate change. And there's another slide that I had added last minute, but I'm going to just talk through it. That is the extent to which countries have implemented their international health regulations and the capacities to cope with international health emergencies, which include outbreaks from deadly infectious diseases. And what is interesting there is that we see that it's the most vulnerable countries with low human development index and medium human development index,